Welcome to our newest episode of the Lebanese Physicians Podcast. And today we'll be discussing the status of HIV/AIDS in Lebanon and the MENA region. And our guest today is Dr. Nesrine Rizk. Dr. Rizk is a infectious disease specialist and an HIV specialist specifically, who is currently practicing at the American University of Beirut Medical Center, where she's assistant professor, and she has been involved in HIV care in Lebanon since she moved back there from the US, where she worked and where she graduated from Case Western Reserve University. Welcome, Dr. Rizk, to our podcast.
Thank you, Dr. Diab. Thank you. Thank you for hosting me today.
Yeah, thank you for being on the podcast today with us.
Thank you.
Yeah, you've been involved. So since you moved to Lebanon, you have been involved in HIV care in the country. And I've seen that also you have been involved in HIV worldwide, actually, because you've been to multiple conferences, you've been an invited speaker, and you've actually arranged multiple international conferences in HIV. So how did you get involved in HIV care?
So I've been interested by HIV ever since I started reading about that. I remember reading in the newspapers, hearing on the news about AIDS and the epidemic back in the 80s, and the devastation that the disease caused in different parts of the world. The many questions people had, and the many uncertainties, and then later on the spectacular advances in science and medicine, HIV medicine, in terms of treatment. What we know today and how we practice today is so different. So I was interested in the beginning, and I suppose I kept that. And the HIV field and HIV medicine and the science around HIV and the infection are extremely interesting and very stimulating. So it's a pleasure to be involved in this field and to be, practicing as I am today.
Yeah, I think it's great that you're involved in this. I'm sure you're needed very well in the region right now. And so just a question about, do you have any data about the number of HIV patients in Lebanon and the MENA region, or the number of HIV diagnoses that are currently reported in the region?
So I think I shared with you earlier a couple of slides, and the latest UNAIDS information data from the Middle East shows that there are around probably 500,000 people living with HIV in the big MENA region. That's the Middle East and North Africa. This region, even though the number is not great, but this region is one of the 2 regions in the world only that have or continue to witness the sharpest increases in the number of new infections compared to previous years, and where the mortality, unfortunately, from HIV and AIDS continues also to rise compared to previous years. So, which means that we're missing a lot of new infections, probably, and HIV is spreading in this region, and it's not. Again, the numbers are not very big, but the increase in percentage is interesting and seems to continue despite, in comparison, for example, you have other parts of the world, especially sub-Saharan Africa, where the epidemic's been controlled very well. You see a drop in the number and the percentage of new infections, and a drop in the mortality compared to previous years. So globally, we've achieved great results globally in terms of curing the epidemic or slowing it down, in the sense that new infections have decreased. However, in the Middle East, it's the opposite. And hence, the need to intensify the efforts probably and do more to slow this epidemic.
Why do you think this increase is happening? Is it because people are starting to test more for the virus right now?
Well, there are different. There are different explanations, different theories. Unfortunately, none of the countries or nations in the Middle East are. The UNAIDS urges and asks all the countries to basically report their numbers, and we see from the reported data in the Middle East that they're not, as I said, a lot of cases, but we continue to see a rise. Several factors contribute to this, and I believe it's true. I mean, the numbers are true. Whether we're testing, it would be great if it's just because we're testing more. where I think that our perception as HIV practitioners and experts from the region in discussing this with epidemiologists from the Middle East, that in fact, there are pockets of infection and then key populations that contribute to the rising numbers and keep on fueling this epidemic, particularly among men who have sex with men, female sex workers and their clients, and IV drug users across this, again, Middle East and North Africa. Every country is different. Every country has a different population or demographic and particularities in terms of the populations involved. However, it signifies, the rising in the number signifies a delay in controlling a true lag and really controlling and preventing no infections from occurring. I think, I don't know if you saw the slides, the UNAIDS advocates for a comprehensive treatment cascade for HIV. And we know that, doing HIV medicine, practicing in this field for several years, different places in the world, it's not very easy to, of course, engage patients and first of all, get people to get tested for HIV. There's a lot of stigma around the test itself. Nobody wants to be tested. It's always very scary. People, wherever they are in the world, there's something about this test and this disease that is special, and that's related to the stigma that's stuck to this infection and this medical condition from the early days, from 1980 and 84. So there is that. And then after testing, you want to make sure if somebody tests positive, that they're retained in care and engaged in care. And that's a very difficult step also to achieve. And then third step is to make sure they're retained in care. They keep coming, they keep taking their medications, they're engaged, they're doing their tests. And there also are issues with that. A lot of it is also unfortunately related to the stigma that the subjects perceive and that they live and go through once they are diagnosed with HIV. And a lot of that stigma is internalized. It has to do with the way the society or the environment perceives an individual who's positive. Well, the whole stigma with HIV sticks to people living with HIV. And that's true in different places, but of course it varies in different regions in the world and based on the population as well. And then after the retention and you want to achieve, of course, viral suppression, which is our success, and the marker of our success in terms of HIV management is this measure, viral suppression, undetectable viral load. That's how we know that we've achieved a success. And we need to maintain that undetectable viral load by taking the medications. And that's where HIV changes or turns into a chronic condition that requires serial testing over the year, regular checkups, visits to the doctor, and continued medical therapy, of course, because our medications are so far, at least in the MENA region, taken daily and orally. So there's that cascade and that continuum. And then there is a fourth, very important one that's been added also to this cascade is the quality of life. And we want to make sure that people living with HIV, because we recognize there's so much stigma around HIV, whether in the MENA region or in Africa or in Europe or in Latin America, it's different according to the region. However, this quality of life we perceive we can do better to make this quality of life better for people living with HIV after being engaged and maintained and virally suppressed to enjoy their lives as they should, full, healthy, long life, because we know that treatment is prevention and treatment is treating people, anyone infected with HIV, if they present early on during the infection, the course of the infection, started on treatment early, then that person will have a life expectancy that's similar or maybe greater than longer compared to other individuals living in that society or that context, which is amazing. It speaks a lot about how well those medications work, how well this whole continuum and spectrum of medical care that starts with testing and engagement and retention and then suppression and every step of the way. So I was talking about the continuum and how important it is to make sure and guarantee that we're doing right, because this is the measure. And the WHO and the UNAIDS expect that if everyone living with HIV globally, if 90% of people living with HIV know their status and 90% of them are engaged in care, and then 90% of them are undetectable, then we can achieve, by the goal originally was 2020 and then pushed to 2030, we would achieve zero new infections at the global level, because treatment is prevention. If we guarantee that the majority of people living with HIV know their status and they're appropriately engaged in care and maintained on medical treatment to keep their viral load suppressed, we make sure that this virus is not transmittable or transmitted to their sexual partners, to their children, and anyone around them, whether sharing needles or IV drug use and other mother to child or sexual intercourse.
Right, so you cut the chain, right? You cut the chain.
It is a chain. Yeah. It is a chain, and starts with testing and then engagement and then virus suppression. And then the fourth very important element is the quality of life. That is very important to also consider in when thinking about this spectrum and the continuum that includes this. So it's easy on paper, and I think it's a brilliant concept. It makes sense. And we see that our patients and people living with HIV who are undetectable do not transmit the virus. So it's very important for the individual themselves, because we can, as I said, guarantee that anybody would have a long, healthy, happy life, provided they keep taking the medicine, because we currently do not have a cure yet. And from a public health perspective, then it is important, because we want to make sure that HIV is not transmitted to new partners or new subjects. And therefore, we would achieve eradication of this virus and the pandemic by 2030, hopefully, or maybe COVID would have changed a lot of this, delayed the implementation of certain measures in different parts of the world and affected differently the spectrum. And a lot of the efforts that have to do with prevention and testing to start with, everything was slowed down due to COVID. We know that from other medical conditions, and COVID has also affected HIV and probably more than other medical conditions because of the vulnerability of the individuals concerned by HIV, whether at risk or living with HIV. Especially in the MENA region, those individuals are more vulnerable because they belong to key populations that are generally marginalized in different ways. So that is a challenge. And I see that this is a challenge. We're starting to talk about that. At the IAS 2021, a lot of the discussions were focused on the impact of the COVID pandemic on the HIV pandemic, the similarities, the parallels, and then also the impact in terms of slowing down all the successes and negatively impacting our fight against HIV. And hopefully we will learn lessons from the COVID pandemic and how we dealt with it, and a lot of successes in the COVID response that can be applied to the HIV fight, such as implementing more telehealth, making it easier for people to access medical care without moving. And that's super important when we're talking about vulnerable people, marginalized populations, individuals who feel threatened because of their sexuality, because of their profession, because of their mental health issues maybe, or simply just because they're positive. And in some countries, in the MENA and elsewhere, being positive is dangerous and can basically, people can be threatened, can be aggressed or physically. So it's all part of that stigma, that is psychological, but some also physical violence affects people living with HIV in certain places. So making their visits to the healthcare centers or the healthcare practitioners difficult in space and moving. So telehealth is a great alternative in making the doctor or the healthcare provider more accessible in a safe way to deliver the message. And that is something that I think and I see, and we've already started using really well in terms of providing remote care. The success of the COVID vaccines is also, this is a tremendous effort, and it shows that when there is a will, there is definitely a way to get to a vaccine in less than a year. That is, and now there are challenges in, and we can talk about the COVID vaccines and the inequity in the distribution and everything else later. But the fact that we do have several, not one, but several, 5, 6, 7, 8 functioning, very excellent vaccines with good efficacy in record time shows that, if we're willing, we can get there. So, and it all shows that in terms of HIV, there's probably a lack of a political commitment, a serious political commitment, or serious engagement at the government level for various reasons, again. And it's not only a funding issue. It's not only about the money. It's just also about the political will and the global will at the highest levels. I'm talking governments and international organizations to push the agenda, to pushing seriously towards developing a working vaccine against HIV. And we hope that we can see that in the future, in the very near future. So, I think the COVID pandemic was extraordinary in so many ways. And we've had some time, I think, to consider and ponder about several issues. Again, similarities, differences, but the impact and lessons learned from COVID to apply to different fields, especially as HIV practitioners. And I hope and I think that, all our efforts will probably crystallize and lead to concrete action that will impact positively the lives of people concerned or at risk of HIV, because that's very important to deliver prevention message, prevention methods and prevention tools to prevent new infections, because that's crucial. And that was slowed down by COVID, and also positively impacting the life of people living with HIV.
Yes. So basically, from what I'm getting from you is it's a continuum of care, starting with diagnosis to treatment to viral eradication to finally improved quality of life for these patients. And
exactly.
So it seems to me in the MENA region in Lebanon, correct me if I'm wrong, there's a problem with diagnosis, may be a problem because it's taboo and people don't want to say that they've engaged in high risk behaviors because that could mean that they could get marginalized or viewed in a different way. And so they try to suppress that and not diagnose themselves with HIV, right?
Correct. I mean, the stigma about and around HIV is basically a problem to people concerned, whether because they're at higher risk or living with HIV. And this is a problem in the MENA region. So you'll see the numbers from this UNAIDS cascade. And I mean, if the UNAIDS is aiming to have 90% of people living with HIV know their status, I think in the MENA region, it's the total number is globally is less than 50%. And then the cascade, you end up with the third step is the number is, if I'm correct, from 2019 was 21% viral eradication among people living with HIV who know their status, which is a very, very low number. And there's a big gap. If 90% is a goal and 21 is a big, big way to go. But I agree with you. It's the biggest problem is diagnosis and testing. And again, for various reasons.
Okay, and how are you dealing with that specifically in Lebanon and the MENA region? Like, do you have awareness campaigns or?
They're definitely pre-COVID, because COVID slowed everything down, as we mentioned. So pre-COVID, there were a lot of awareness campaigns yearly. But again, it's the problem is the stigma and the political will and the funding for all these programs. That was probably HIV is never perceived as a priority for any government, whether in the MENA region or elsewhere in the world, in a serious way. So it's a problem when there's no real political will and no interest, and in addition to the negative connotation and the stigma around the problem. So it explains why we're probably not seeing more efforts. However, we have a very active civil society in the MENA region, and it's very important to mention their efforts across those countries, creating networks among them of people living with HIV, people at risk with HIV, or simply just activists, creating a big network of organizations helping each other and providing support to each other across the countries, because there definitely is a need to be organized in order to fight this epidemic. If we're going to win soon, then we all need to put our efforts together. And the civil society organizations, NGOs, and non-governmental and civil society groups, activists have, realized that a long time ago and are pretty active. And it's good to see because they basically partner in several MENA countries with governments to provide the services, whether it's prevention efforts and campaigns, testing campaigns, and then later on in terms of creating healthcare centers, creating networks for people living with, support, providing medications, and providing medical care in the years after the diagnosis. So this is a very active society, active groups, and a pretty energetic network that I think once the COVID pandemic ends, we'll see good results or a different, maybe more energy again and better results.
Can you give us examples of names of these NGOs that you're some of them?
Well, there are several. I mean, there is the SALS in Tunisia, and you have MERSA, SEDC in Lebanon. Those are the ones that I can think about now, and many, many others. During the IAS, we had a presentation by a marvelous group of activists from Pakistan who were basically, it's an NGO involved in HIV care, the continuum of care, if you will. And they presented their data about retention and how they were engaging partners with the people living with to keep them retained and engaged in care and provide the services. It's across the globe, of course, but also across the MENA region. And great examples from Turkey, excellent activists who take really big risks to support people living with HIV, IV drug users, to providing safe injection sites. And that's not easy in this context. We're talking about countries and governments who criminalize same-sex and criminalize IV drug use and do not recognize the mental health dimension of drug use, for example. So, I mean, you see all these NGOs doing superbly well to protecting people at risk and providing services to them and reaching out to homeless individuals, to sex workers, to provide, again, education, shelter, support, testing, medication, and support. Because HIV can be a very lonely disease.
So I guess once the patient is diagnosed, let's say in Lebanon or other places in the MENA region, they have to probably connect with these NGOs and then try to find an HIV doctor.
It's not necessary.
Yeah,
it's not necessary. It depends. It varies. Being involved in the spectrum, a lot of these activists or these NGOs and other also governmental agencies. So what happens if the test occurs through an agency, whether governmental or NGO, then that person, when they receive their diagnosis, will be offered, of course, through that network or through that agency, medical care or referral to a practitioner. So usually this is what happens. It's the continuum. And, you have social workers, case managers, in addition to nurses and pharmacists and physicians, and varies depending on the setting where people will be followed. The other scenario is a person getting the test on their own for various different reasons. And they would seek medical care and independently of any governmental agency or NGO and proceed to meeting with a doctor and getting their care independently. So it's definitely not mandatory. It's easier, I think. It's nicer because that network will provide support with peers, and that's super important. And we would like, as a practitioner and HIV practitioners, we really do value the input of people living with HIV, being advocates and being part of our agencies, our networks, our initiatives, because it's very important to listen to their experience and get from them what works best, what needs to be done, how things need to be changed, what we need to do differently, what we need to continue doing, what we need to stop doing, how to basically proceed. And that is very important. The community, the voice of the community is very important. We need to hear it.
Yeah, it's similar to a lot of other diseases, especially for us in the pulmonary world. So the other question I have is, once a patient is diagnosed, right, they seek care. So the HIV doctors, let's say in Lebanon or other countries, are they just based in Beirut, or can they seek care and see an HIV doctor in a region that is close?
In Lebanon, for example, the medical care is centralized. right? I mean, there are big cities along the coast and maybe inside or more deep in Lebanon, but in general, care is centralized to Beirut in the big Beirut area in Lebanon. I don't think it's the same in bigger countries. For example, in Egypt, you'll find big medical centers and teaching hospitals in large cities and closer to where people live. So it really depends. But it's true that, it's an infectious disease specialist that is important to have, whether leading or taking care of people living with HIV. It's very important. And some HIV practitioners in general can be of any background, provided that they have the training and the expertise in taking care of HIV, whether they're internists or family practitioners or other, provided that, however, they get the experience and the training to do that.
Because obviously, if the doctors are far away, then either you do that with telehealth or
exactly. So this is
doctor.
Yes, but a lot of times people living with HIV prefer to go see the doctor far away from the village or the city they live in because of the stigma, right. And because nobody knows them where they're going, so it feels safer, and that is part of the whole challenge and the whole issue.
And another question I have is, once they're diagnosed, obviously because of the stigma, do you see that there's higher rates of depression or anxiety in patients in the MENA region compared to other countries in the world?
We've started enrolling in a study to assess that in Lebanon, and I'm hoping that we can partner with several treatment centers in the MENA region to providing the same questionnaire to assess actually the impact of stigma and depression on people living with HIV and assess that prevalence of these problems. But traditionally and across the world, and going back to the early days and even more recently, several studies from different places indicate that people living with HIV suffer, in fact, more from depression and other mental health issues. And whether this is related to the stigma has a big part of that. And we talk about it, it's clear and obvious in the Middle East, because of the criminalization of same-sex or IV drug use, or the key populations concerned with HIV, where we see, are more marginalized in this Middle East. However, the stigma is also present in other more liberal, less conservative societies across the world. And that is a reality that is taking time to change.
And then once you start on medication, the medications are available, I guess, freely to the patient,
yes.
Right?
In Lebanon, they're free, and I think it's across the MENA region, there definitely is a great support from the WHO and the UNAIDS to creating first national AIDS programs across these countries. And those programs and those developed are well established, well developed, and they maintain this continuum. And even during the COVID pandemic, we had a great session at the IAS. And if you want, I can share the link to it. It's available on YouTube, where despite the COVID, the lockdowns and the shortages in medications across this Middle East, at least, the programs were able to maintain the drug supply and keep the medications coming and delivered to the people living with HIV, and in different ways, whether they were mailing the medications or creating car pickup stations to pick up the medicine outside of the institution or the pharmacy, or having it delivered directly to the person, or providing several months supply ahead of time when those medications were available to maintain and basically ensure that no treatment was interrupted. And I think they did well.
Yeah, so basically, I think that the most important thing in Lebanon and the MENA region is to encourage patients to go get diagnosed and then fight the stigma. We
really need to fight the stigma, as you said, but super important, because this is the hurdle, this is the obstacle to delivering the information about prevention, about HIV, to people who are concerned, who are more at risk, and to everyone in society. It shouldn't be a problem. Teaching kids, teenagers, everyone about modes of transmission of HIV. And that should also be part of a bigger sexual education and sexual health module that needs to be built probably more cohesively in the MENA and across. We realize finally that HIV care should be part of a bigger sexual health umbrella. And that in order to provide the testing appropriately to the people who deserve or who are more at risk, it needs to be part of a sexual health comprehensive care that delivers education, awareness, prevention methods, vaccination, condoms, regular testing and screening for syphilis, chlamydia, gonorrhea, HIV, and others to prevent infections, to screen, to detect early infections, and engage in care to reduce transmission to partners and worsening. So this is where it starts. And then maintaining, of course, the continuum of care that we talked about is also important. And stigma-free. Everything needs to be stigma-free because it's about medical care, a medical problem. Of course, that has, a lot of social relations to, but everything is, what is not, medical care.
So do you think the future is bright for fighting HIV in the MENA region? Or do you think there's going to be a lot of hurdles coming up that could take things back?
I mean, I don't think that there will be more hurdles. I think the hurdles already exist, and it's just a matter of time and working all together to work around those hurdles, try to destroy that big wall that is stigma, and then to take one brick at a time. It will take some time. I don't know how long, how much time. We certainly do need to imply on the governments and basically to encourage them to be more serious, more committed in terms of providing more funding and providing the political will and the political push to advancing this agenda further and more efficiently.
So thank you, Dr. Rizk, for being on this podcast and for sharing your expertise on HIV care. I think hopefully people have learned a lot about the continuum of care for HIV patients, both, I guess, internationally and in the MENA region. Thanks for all the work you do for the MENA region.
Thank you. Thank you, Dr. Diab.